In this video, we will cover the workflow of an ED physician seeing a patient that will then be admitted. For the scenario, we will have an ED physician, Dr. Cargill, seeing a patient RVH demo, admit, in the acute area with a shortness of breath. We will be placing an imaging order, lab order, medication order, documenting an ED note, placing a consult to a hospitalist, Dr. Ali. Dr. Ali will then admit the patient. Dr. Cargill will click the To Be Seen tracker to look for RVH Demo Admit and click the Sign Up button. The patient will now be added to your My List tracker. Within your My List tracker, you can now look for RVH Demo Admit and click on the orange bubble under the chief complaint to see what the triage nurse has indicated. On the right side, you will notice the vital signs that has been entered within triage. Dr. Cargill will now click the No Document section. This is to start your ED report. From here, you're going to find ED report. You don't necessarily have to document, you can just click the Save button. This is to start your documentation as a reminder for you to complete your ED report, and it is part of your signed list to be completed. Dr. Cargill sees the patient and determines that a chest x-ray, blood work, and a Ventolin medication needs to be ordered. Dr. Cargill will go back to her My List tracker, find a patient, and click the Orders button icon. The order screen will come up. You're going to click the Enter tab. Under the Search All, type in RAD chest. This will display all the chest imaging. Note all the X-rays orders are prefixed with RAD. We will now pick RAD chest to views. Under the relevant clinical information, we are typing in shortness of breath. We will continue to place order for the lab work and medication. We're going to click the Search All field to enter the blood work. CBC. Lights. Glucose. You'll notice as well that right beside the word submit, there is a red flag with a number. This indicates the orders that you have placed so far. We're now going to pick a medication order, which is Ventolin. So under the Search All, we're going to type in Ventolin. And we're going to pick the 5 milligrams nebulized every 4 hours PRN. Now that I've placed all my orders, I'm going to press the Submit button. It will prompt you for your PIN. Once you've entered your PIN, the orders will now be processed. We will now hit the Close button located at the black navigation bar to bring us back to our tracker. You will notice in the tracker that a RAD, lab, and MAR icon has appeared. This means that the order has been placed. You can now click on the draft section for the RVH demo admit on the patient tracker to start your documentation. Within the ED report, you can see the triage reference that has come across. And we're now going to click under the assessment box and start our dictation. You can either use Dragon or type out your note. I will be using Dragon. Patient came into the ED department with shortness of breath period. Patient states, open parenthesis, while outside working in the garden today, I started to feel that I can't breathe period, close parenthesis. Patient has an audible wheezing when he speaks period. He denies any chest pain period. Sending the patient for chest x-ray, blood work, and ordering Ventolin 5 milligrams every 4 hours PRN period. I will now click the Save button. This will now bring me back to my tracker again. Patient had had their x-ray and lab work done. Results has now come back. We're going to click on the My List tracker and look for RVH demo admit. And you will notice now that the RAD icon and the lab icon will turn green. This indicates that the result has come back. Once you open the RAD icon, you will see a document icon, and an X-ray image icon will also appear. For this demo, you will only see the document icon as we are still in the process of building the X-ray image icon that will allow you to see the PACS image. We're going to click on the document icon to review the chest X-ray report. Under the lab icon, you will notice a yellow dot. This indicates that there are abnormal values. We're going to see the result now by clicking on the lab icon. In here, you'll notice the ones in yellows are our abnormal values. After reviewing the results, the physician now determines that a consult to a hospitalist is needed. Before placing a consult order, you need to speak to the consulting physician first. For the demo, Dr. Cargill has spoken to Dr. Ali about consulting her ED patient. Dr. Cargill will now click the order button for RVH demo admit. Click the Enter tab. Under the Search All, we will type in consult, hospitalist. Under Reason for Exam, we're going to enter under the provider, we're going to type in Ali, Kevin. Has the provider been notified? Yes. And we're now going to hit the Submit button. Once you click the Submit button, you'll process the order by doing this. For this section, I will now be Dr. Kevin Ali, the hospitalist. The hospitalist receives the consult request. looks at the patient's chart before seeing the patient. Dr. Kevin Ali will now look at the My Workload to see the consult request. He will now click RVH Demo Admit. In here, you will see the reason, query pneumonia for potential admission, that was entered by Dr. Cargill. From here, he will open the patient's chart to review the lab results, imaging result, and any document that has been done. So we're now going to click the chart button located at the black navigation bar. At the front is the summary that shows you the lab results that has been done, the provider note that was done as well, and any other information that has been documented so far. You can also click on the Diagnostics tab. In here, you'll notice laboratory information. If we click on Imaging, the information is in here as well. Click on the document icon and you'll see the actual results. You can proceed under the provider notes as well. Click on the document. You'll notice the status is still in draft. Shows you the information that Dr. Cargill has indicated within her ED note so far. After reviewing the information, he will now see the patient. Dr. Ali has now seen the patient and determines the patient needs to be admitted now. The hospitalist, in this case Dr. Ali, will do a full managed transfer. Since the patient's chart is still open, Dr. Ali will now click the Orders button located at the black navigation bar. He will then click the Transfer tab. Under the Admit Transfer Order, type of transfer for admission, we are now picking Admit from ED. You'll notice there are required fields that needs to be entered. We will now proceed to put in that information. You'll also notice at the bottom where there are other information that was entered during the ED stages, where you can either continue or stop any of the orders that was done. In this case, we will stop the medication, the Ventolin that was done in ED. So we're going to press the stop button. From here, we will now go into the Add New tab to enter our pneumonia admission order set. Under the Search All, we're going to type in pneumonia. Or we can also click under Sets. And here's our pneumonia admission. You'll notice that under the pneumonia admission order set, there are some pre-check orders. And if those orders are not needed, you can simply uncheck them. We will now proceed to fill in the pneumonia admission. Under the resuscitation status, we are picking a full resuscitation, getting it from a capable patient. The next part for the diet, we're going to use the as per protocol. You will notice the P in here. Once you click this, it will open up a link that indicates the protocol for this particular order that we are picking. We're going on to our activity restriction, elevate head of bed routine. We're going over the IV maintenance section, which we're going to pick the peripheral IV. Under the IV solutions, we're going over the IV maintenance therapy. We're going to pick normal saline, 30 mils. And we're going to be changing the 30 to 75 mils per hour by clicking on the 30. Notice now that we've changed the order. We're now proceeding to the medication section. Under the antibiotics, we're picking Clavalin 875 milligrams POBID. And under dose instruction, we're going to be typing in We're now going to proceed to the bronchodilator section. And you notice in here there was Ventolin already that was ordered. So we're going to keep that one. Under the antipyretics, we're going to pick acetaminophen. And then under the lab, we're going to pick blood cultures. Under the mic source, we're going to pick blood peripheral draw. As we go further down, you will notice suggested order sets. We're going to be referring the patient to RT. So we're going to click Allied Health Referrals. Referral respiratory therapy. We're going to pick this. Under respiratory therapy referral reason, we're picking other. Under other referral reason, we're typing in community acquired pneumonia. We're now done with our admission. We're going to click the submit button. In here it's asking when the first dose should happen, and we're going to say today at this time frame. I'm going to hit save. Do we wish to continue for making the resuscitation status as full? And we're going to say yes. We're now going to enter our PIN. Now that you've submitted it, the nursing staff will now acknowledge and process the orders that has been indicated, and clerical staff will now admit the patient. Dr. Ali will now document his hospitalist consultation report. Since he is still within the patient's chart, he will now click the document icon located at the black navigation bar to start his documentation. He will look for hospitalist consultation. From here, he will click on the narrative box where he can either type or use Dragon to dictate his note. For this demo, I'll be using Dragon. The patient is a 32-year-old male who presented to the ED department with shortness of breath, period. Patient has a history of asthma, period. Next paragraph. A consult was requested by the ED physician, period. After examining the patient, comma, reviewing the chest x-ray and lab results, comma, I have confirmed that the patient's best course of treatment is to admit the patient, period. The patient is admitted with a diagnosis of pneumonia, period. From here, I will now click the sign button. We will now go back to Dr. Cargill, who needs to finish her ED document on the patient. Dr. Cargill will click the My Patient. Dr. Cargill will now click the My List tracker, where you can see the patient RVH Demo Admit that has been admitted now, and it says Admit No Bed. From here, she's going to click the draft icon. And continue her documentation. I will use Dragon for this demo. Next paragraph. The X-ray report indicates segmental pneumonia, period. Consult to the hospitalist was sent, period. Hospitalist saw the patient and determined the patient will now be admitted, period. I will now sign the document. This ends the ED physician workflow. If you have any questions, please feel free to call your Expand support team.